Anxiety, a societal issue. Firstly, what is anxiety? Anxiety is a mental disorder characterized by feelings of worry strong enough to interfere with daily activities. There are many different types of anxiety disorders. The most common are generalized anxiety disorder, known as GAD, social anxiety, specific phobias, panic disorder, obsessive compulsive disorder, known as OCD, and post-traumatic stress disorder, known as PTSD. Symptoms. Not all symptoms of anxiety are obvious. This is because it often develops slowly over time. Often people who have anxiety experience more than one anxiety symptom. Depending on the individual, many experience depression with anxiety, as they are known to go hand in hand, but this isn't always the case. Anxiety comes with many different symptoms. These symptoms can be different for everyone. These consist of restlessness, worry of the future, unable to concentrate, tired, can't make decisions, muscle tension, sweating, shortness of breath, irrational fear, rapid heart rate, weakness and lethargic, wanting to avoid the thing giving you anxiety, and repetitive behaviour. Symptoms of anxiety might not go away by themselves. If left untreated, anxiety could start to take over your life. What does anxiety feel like? Anxiety feels like there's no escape. Feeling like you're so alone and stuck that everything is closing in on you. You feel like you're drowning but no one can hear you scream. You're trapped in your own head with a million thoughts racing through your mind. Feeling like you're stuck on a bus that never makes any stops. Anxiety is like a battlefield, a never-ending war between you and your thoughts. What causes anxiety? Anxiety isn't brought on by one factor, but by multiple factors. Many factors can cause anxiety, like personality factors, difficult life experiences, and physical health. Sometimes the cause of anxiety is because of a genetic predisposition. Even though this sometimes happens, just because it's genetic doesn't mean you'll have it. Ongoing stressful events is one factor that can cause anxiety. Some of these are work stress, family relationship problems, abuse or trauma, death or loss, pregnancy or giving birth, emotional shock. Physical health problems can also cause anxiety, such as diabetes, asthma, hypertension, and heart disease. These things can also have an impact on your anxiety, and your anxiety can have an impact on your physical health problem. Another cause of anxiety is people who abuse alcohol and substances. This can increase anxiety levels. Who it affects. Anxiety affects the individual, but it can also affect their family and friends and their workplace and community. But first, let's take a look at how it affects the individual. Although most symptoms are the same, some people have higher levels of anxiety than others. Anxiety has a big toll on the individual's everyday life. Anxiety makes it hard for an individual to function. They struggle to do everyday things that a non-sufferer wouldn't think twice about. such as getting out of bed, going to work, eating, leaving the house, and socializing. Now let's look at how it affects their family and friends. It affects their family and friends as they might not understand what's going on, so they become tired, frustrated or angry, and helpless. This can make their relationship suffer and become broken. If a family member or a friend makes negative comments such as, "Just get over it," "Stop worrying," "Don't be silly," "You're worrying about nothing," "What's wrong with you?" This can make the individual feel worse. Family and friends need to be patient and understanding. It helps if they do their own research and learn about it, to be able to support the individual. Now, their workplace and community. The individual struggles to be out in the community at work. This is because they cannot function. They cannot cope at work because of their anxiety. They cannot handle the pressure of the job and wouldn't be able to work to their full capacity. They struggle to walk around the community and act like they have it all together, but they're drowning in their own thoughts. Facts and statistics. Anxiety is the most common mental illness. Anxiety affects your physical and your mental state. Some people who suffer from anxiety turn to drugs and alcohol rather than seeking help. Studies show people who have certain personality traits are more likely to have anxiety. Some of these are lack of self-esteem, easily flustered, timid, or inhibited. Every year, 14% of Australian adults develop anxiety. It's estimated 10% of teens and 40% of adults have an anxiety disorder. 2 out of 3 adults who suffer do not receive treatment. Teens receive even less, with 1 in 5 receiving treatment. Statistics show women are more affected by anxiety than men, with 1 in 8 men and 1 in 5 women. Only 36.9% of people who suffer seek treatment. Anxiety affects 25.1% of children between the ages of 13 to 18 years old. Studies show that children who suffer from anxiety have a higher risk to work poorly in school and miss out on social experiences. Globally, 1 in 13 suffer from anxiety. How to get help. Anxiety is very treatable, and there are many websites to visit as well as phone numbers you can ring, such as Beyond Blue, Helpline, and Panda. They are also a 24/7 helpline in case you need to talk to someone urgently. These websites are very useful for those who suffer and those who don't. It is highly recommended to check out these websites, even if it is just to develop more knowledge. Getting help by seeing a counsellor or a GP is very beneficial. Talking to someone helps. They let you know you're not alone. The GP can also prescribe medication, which can minimise your anxiety level. There are even everyday life changes that you can do to minimise your anxiety, such as eating healthier foods, exercising at least 20 minutes a day. These few things can minimise your anxiety. Remember, you're not alone. You're never alone.